I think I should say sanitation is very easy to neglect. To start, most people are not raised to talk about poop, and it is very difficult to discuss. In the community, sanitation is not in their top priority. People are more interested in buying cars, having good televisions, and buying expensive mobiles rather than having a toilet.
For local and national government, sanitation isn't as glamorous as other sectors like roads and education. But here's the thing, sanitation is actually very important. On the public health side, people do not realize it actually. Lack of proper sanitation causes a lot of diseases that can be easily prevented.
Poor sanitation and hygiene also perpetuates gender inequity. Girls sometimes miss days from school during their monthly period because they don't have access to a hygienic toilet and also sanitary napkins. There's also an additional burden for women who most often care for children and the elderly.
But it's actually economic impacts that is most often overlooked.
Bhutan provides free public health and education. The collective cost to the country of treating sanitation-related illnesses can be huge.
So in 2008, we engaged SNV to help us develop a new approach to sanitation and hygiene with the aim of achieving universal access to improved sanitation in Bhutan. The result was the Rural Sanitation and Hygiene Program.
We wanted to show that a subsidy-free approach and based on mobilizing community action through demand creation is more effective and sustainable.
Our integrated approach focuses on fostering positive hygiene behavior change, building demand for improved sanitation, fostering private sector solutions, and developing effective wash governance at all levels.
Another reason I think the program is unique is because we don't use group shaming as a tool. We start with what the community has accomplished in other areas and build on that to create momentum for change.
After 7 years, there is widespread recognition that this program is really working well. And this approach has been fully endorsed by the Minister of Health.
The impact of improved sanitation is clear. We are seeing fewer cases of diarrhea, particularly among children and elderly people.
With the help of UNICEF and the Red Cross, the program has now reached 9 districts, mobilizing families and communities to invest into improved sanitation without subsidy.
In order to reach poorest 10%, the whole community came together to help. Some donated time, some donated money. Getting to 100% was not easy, but we did it.
We have made significant gains in improving sanitation, but there is much more to be done. Beyond expanding coverage, we are also broadening our focus to include areas such as menstrual hygiene management, hand washing, and fecal sludge management.
We are also working to ensure that the program does not leave anyone out, including the elderly and people living with disabilities. The government of Bhutan has made sanitation and hygiene a priority, committing to increasing rural access to improved sanitation and hygiene from 54% to more than 80% by 2018. While this is a big step in the right direction, there isn't sufficient funding attached to this commitment.
Achieving the goals Bhutan has set will require strong leadership and investment from the government. This means prioritizing sanitation and hygiene in budgets, in plan, and in the minds of our local leaders. If we can do that, we can achieve universal access to improved sanitation and hygiene in Bhutan.